Good morning, Lisa. How are you doing?
I am so good. How are you?
Doing very well. Last probably, talked, you had your procedure in 2018, correct?
Yep, 2018.
And, at that time we treated your lower three lumbar discs as well as the facet areas. Tell me a little bit about what you were experiencing at that time and how you're doing now.
So at that time, I mean, just ungodly, ridiculous pain and discomfort and just an overall tightening and restriction. Wasn't able to do workouts. I was fearful of, because if I did the wrong movement, my back would go out, I would get stuck sideways, and then that would infringe upon my life for, anywhere from a week to 2 weeks. And it was just this murderous cycle of feeling okay and then doing something that popped my back out, and then ridiculous amounts of pain. And something that I was dealing with for the better part of a decade because I didn't want to have a spine surgery.
And then at that time, we injected both fat-derived cells as well as bone marrow into those lower discs. You had a pretty good disc herniation at 4-5 as well as degeneration at the other levels. How are you? How are you today?
Unfathomably amazing. I seriously, I can't even tell you. I'm playing golf again. I can snowboard again. I workouts super regular. Before my back would go out 4 to 6 times a year for anywhere from a week to 2 weeks, like I said, sometimes a month. And I have not had one single back outage. I don't have any pain. I can actually sleep at night. It's honestly just remarkable.
That's fantastic. And as far as, the procedures themselves, you were comfortable,
Yeah, it was super, super easy. I mean, you guys were very great and everybody made me feel really comfortable. And I honestly thought it was going to be a lot worse than it was. Just, we're getting marrow out of your bones and we're going to do a little lipo in here. We're going to pull this and we're going to inject it all back in. And so I was like, oh my God, this is going to be horrible. But honestly, afterwards, I was ready to drive myself home. And you guys were absolutely emphatically not. It was easy. I had some bruising and a little bit of discomfort, but easy.
Great. That's great. And as far as the staff and making plans and, your communication?
Yeah, super. Everybody was really great. Like I said, everybody made me feel comfortable and just made sure that I kind of had everything I needed. I knew what to expect, where to be, when to be, what we were doing, why we were doing it. And yeah, it was just a really lovely experience all the way around with all you guys.
You had an MRI just recently, and the beautiful thing about that is that MRI is so much improved over your baseline, and the huge herniation you had at 4-5 is almost completely resolved. So not only are you feeling better, but your MRI looks better.
Yeah, I mean, I think that thing was 12 millimeters, and then I know that there was a bunch of concern with spinal stenosis and the narrowing of my spinal canal and stuff like that. And even in that report, it says that has overall.
Yeah, you've gone from, pretty severe stenosis to, really, mild, if at all, stenotic at this point. So you're back in the game and I'm really happy for you.
I'm happy as well. Life-changing. And when you take a look at the life that I could have had if I didn't do anything about it, or if I did have a massive spine surgery, which just absolutely terrified me, and that would have messed up, made a different course in my life, versus this option and being what it was, and now being able to move forward as a normal 43-year-old doing normal things and not having to worry about any of that. It's got my life back.
Well, thank you so much for taking the time to do this.
Thank you.